mind that when you do expressive language therapy, you're going to be involving some receptive therapy also, and vice versa, just as we talked about in the previous sections. It's very difficult to do expressive or receptive therapy without the other. Simply try to focus on the goals and objectives of that child. Okay, this week we're going to talk about expressive language therapy. The age group we're going to talk about is preschool. Keep in mind that you are going to want to be at their level. So you need to use a table such as this that is low to the ground. You would sit on one side and have the children in front of you and to either side so that you have easy access. In this lesson we're going to talk about labeling items and getting some expressive language from the children. We're going to start with items that start with B. The unit in the classroom worked on B. So we're going to follow suit and do labeling that corresponds with that. First, you're going to take items, hopefully that are very realistic looking, that start with B. You can begin by asking one of the children what this is. If they do not know what it is, you're going to provide the label for them. Banana. Say banana. Once you get an imitation, you can go on to the next item. Keep in mind that oftentimes children can only have one or two choices. Other children may be able to use more choices. Today we're going to use 4 choices. A bumblebee for some of the kids that have higher language, a bear, balls, and a banana. If some of the kids you're working with need to work on plurals, then you want to focus them in on using the word balls. Okay. The next thing we're going to do is we're going to talk about what this is. For example, I might say to the kids, what is this? What animal do you think this looks like? If they say bear, you want to make sure they know they're correct. If they don't, make sure you rephrase it in a very positive way. This animal's brown. Give them some hints. Sometimes you see them in a cage at the zoo. Sometimes you see them in the forest. This is a bear. Can you say bear? Once all the children say bear, then you can begin to explain what you're going to do with the bear. Today, our bear is hungry. He wants to eat items that start with B. These are the items we have that start with B. We're going to sing a song and let each of you have a turn to tell the bear what you're going to feed him. The song is, keep your songs very simple with preschool. Very short and simple vocabulary. This song is something like, bear, bear, what do you see? Bear, bear, what do you see? What do you see that starts with B? And then you would name one of the children. The children then take turns using a complete sentence to name one of the items. If they do not have the complete sentence, you're going to use a fill-in-the-blank format until they can develop that. For example, you might say, I see a banana, and then you might put it in the mouth. That child might be able to imitate the whole sentence. They may not. You may have to break it down and give them a starter sentence like I see a, and then let them fill in the blank and say each word after you. Once they put it in, you can make a joke and start to do humor, which they usually like, and do something like this. Oh my gosh, the bear burped. He doesn't like your banana. Usually that engages them and gets them to start laughing, and they like the activity more. Continue the process until all of the children have had a turn. Make sure that you make the activity at the child's level, raising it to meet their needs. A way to lower the skill is by not giving the child a choice. Just telling them, this is a banana. The bear is going to eat a banana right now. And say, Johnny, you're going to feed the bear a banana. If the child is higher functioning, you might let them choose an item or chose 2 items. You also might work on some memory skills and have that child go last and not have the bear burp things out, but have the child remember everything that the bear ate. Another way to make it more difficult would be to use the plural, or use some more complicated words such as bumblebee if this is also a child that has speech problems.